All right, let's spend a few minutes in talking about the future of medicine. You know, driving around in that little AI-controlled car the other day gave me a little bit of thought about what are we going to do with AI as it comes to medicine. Now, clearly, we know that things like ChatGPT, for instance, can pass the USMLE or the United States Medical Licensing Examination quite easily, and a lot of times they outperform trained physicians in the field of diagnostics, and they'll only get better with time. And if you look at what is the ideal medical student at this point, it is really someone that can memorize a lot of material, regurgitate facts, and follow algorithms. And that is how doctors are being trained, have been trained for quite some time. I mean, I was one of those. I mean, I was really good at memorizing facts. I graduated with honors from medical school. I always did really well on the tests, usually scoring at the very top of the class or near the top of the class. But what they'll be able to do is there are roughly about 1 million doctors in the United States now, about 1 in every 300 people in the U.S. as a physician, and they'll be able to dramatically limit the number of physicians, because what you'll see is you may go to a clinic and you check in with a tablet or something along those lines. You'll be asked questions. You may have a diagnosis, or preliminary diagnosis done that way. Maybe there'll be some confirmatory labs. All this can be done really without a physician, interaction. Now, there may be a physician remotely or, in another part of a building that's kind of generally overseeing all these sort of robots, right? What it'll do is allow for a lot more people to be seen a lot more quickly, a lot more efficiently, and at a much greater cost savings, which will make hospital administrators extremely happy, because they don't like dealing with doctors and their egos and their high salaries and so on and so forth. And so you can dramatically provide a lot of cost savings there. But it's the same model, right? The AI will be trained on the drug model for sure. I mean, that's almost guaranteed. They're not going to, you won't have renegade doctors that think outside the box and say, wait a minute, I don't like this model, or this model doesn't make sense to me, because everybody will be, the robots are not going to rebel against their programming, right? They're going to be absolutely 100% on board with the whatever the algorithm tells them is accurate. And eventually the technology will allow a lot of the specialists and the proceduralists to also be replaced to a large degree. So we're seeing that coming. It'll, again, that is the future. That is going to happen, particularly on the side of allopathic medicine as it stands. And so that's what you'll get. You'll get more drugs more easily, more cheaply. With regard to cutting out a lot of the middlemen, because doctors are kind of the middlemen between the pharmaceutical company and you. I mean, it still has to go through a licensed MD, and that's, the physician still has to do it. Now, most of them do it. Most of them are sort of bought in on this sort of narrative. But, the benefit for that will be tremendous to pharmaceutical companies, because they'll no longer have to wine and dine physicians and, provide them fancy dinner parties and, send, provocatively dressed, attractive people in there to sell them drugs and that type of stuff. It'll be a big boon for those companies. So the pharmaceutical reps will be going out of business. Most physicians will be going out of business. And it won't address the root problem, because we'll still be eating the technologically based food. This is what it's going to be. We're all going to be eating the soy slop, all, developing, cancers, heart disease, autoimmune disease at very high rates, and then we'll just plug into the AI-driven, pharmaceutical-based medical system, and everybody will have their drugs, right? You'll all be on your medications, and everybody will be happy, right? Supposedly, that is the future of medicine, guys. That's what's going to happen. That's what's coming, and so. Just be prepared for that. As a physician, you should be prepared for that. Your job will not exist like it does today. Now, first you'll start out, you'll be tech-enabled, and you'll have an AI assistant, and it'll help you with things. But eventually, you'll be phased out altogether. Or, there will be one doc and, like I said, 50 robots or something like that. But I mean, that's going to happen, all right? And the question is, is that what we want? I mean, would it be better to, stop having sick people, stop creating sick people, right? In my view, that would be the better course. And again, it starts with the basics and the food and all things I've been talking about. But let me know what you guys think. Where do you see medicine going? If you're a healthcare provider and you follow me, What are your thoughts on this? Do you see this as happening? I know there's some nuance in bedside manner and all those types of things, but I mean, how many people are addicted to their phone right now? They don't really care about human interaction as much. We're being that's being filtered away from us, right? So anyway, thoughts for the day. January 12th, day 12, World Carnivore Month. I hope you guys are doing well. Hopefully it's helping you guys. I know some of you guys, sometimes it gets challenging around week 12 for some people, or week 2 for some people. Sometimes people just start feeling enormously better. It just varies a little bit. So I'm happy to see how you guys are doing. For me, I think I'm gonna have some ribeyes for breakfast, and got a busy day, lots of interviews, lots of consults, podcasts and whatnot. All right, guys, let me know what you think. We'll talk to you soon.